Hello and welcome to Health in the Heartland. I'm Karen Blaiklock, and my guest this episode is Dr. Adam Lai, oncologist and hematologist and medical director with the Cancer Care Center at Heart Memorial Health. Dr. Lai, thank you for being here with us today. Our discussion is going to focus around breast cancer, and I feel like we've all been touched by breast cancer with either a family member, friend, co-worker. What actually are the risk factors for breast cancer?
So there are a few risk factors for breast cancer. One, probably the most important one, is family history. So do two or more members of your immediate family have a history of breast cancer? That increases your risk. Is there a known genetic mutation in your family history? That increases your risk. Or if you're known to have that specific mutation, that increases your risk. There are other things that play a role too. So early age of patient's first period or menarche, the earlier they have that, age 10, 11, increases your risk because the body has had a few more years of exposure to estrogen. Late menopause for the same reason, so having menopause well into your mid-50s even would increase your exposure to estrogen. The use of some hormone products, mainly the combined hormones, but not birth control pills, increases your risk. Being overweight increases your risk. Not having a healthy lifestyle, so not having activity or exercise increases your risk. Those are probably the main risk factors when I think about your risk of breast cancer overall.
So really talking to your family physician about your family history, your genetic background, and then also maybe medications that you might be taking, because I heard you say the estrogen too, is that correct?
Yes, yeah, estrogen and progestin combo specifically. The other thing that we have at HMH that not a whole lot of people know about or we're trying to get out in the community is once a month we have a genetics counselor that comes to our office, our building. So physicians or families that are worried about this can actually schedule an appointment, meet with the genetics counselor. They take a full family history. They want to know, moms and what your mom has, what your siblings have, brothers, sisters, aunts, uncles. They'll plot out kind of your family tree history, and then they'll run some I guess risk calculations, and then tell you whether or not they think that additional testing is needed. So that's something that we offer once a month at our facility.
Now we hear the word breast cancer, and not every breast cancer is the same. There's not just one type of breast cancer, is that correct?
That's correct. So breast cancer, the majority of it is driven by hormone receptor status. So the most common type of breast cancer is what's called hormone receptor status positive breast cancer. That means that the breast cancer cells are feeding off of estrogen. So either the estrogen that the body produces, and even after menopause, you still produce estrogen, or excess estrogen that you're taking in. So that's one type. And then there are other types too that have different proteins that are expressed. So HER2 positive breast cancer is another type of breast cancer that we test for. And a lot of these breast cancers are treated completely differently. So it really does depend on the biology of your breast cancer. And so that's something that at diagnosis is extremely important to make sure you have a clear understanding of the biology of your breast cancer and also the stage so that you can get appropriate treatment.
Now you talked about prevention, and obviously being overweight is something that somebody in a sense can control. They can exercise, maybe nutrition, but the other component as far as the genetics and maybe the medications that they're on, that's where they really need to talk to their physician again about what they might be taking as far as their risk factors there.
Correct, and one thing I failed to mention is age. So as we get older, we become more at risk of all cancers, including breast cancer. So really age and what you inherit from your mom and dad, those are the two things that you cannot control no matter what type of cancer we're talking about. But a lot of these other things are things that you can control activity, weight, etc.
Correct. Now, what about our advancements in treatment? I know over the last, I want to even say 5, 10, 15 years, we have seen a lot of different treatment modalities come out related to breast cancer.
Oh yeah, that's a big subject. We could probably have a few talks on that, but yes, there are a lot of new treatments that are occurring. There are a lot of clinical trial treatments that are ongoing as well. But we've made great strides in really HER2 positive breast cancer over the last 15 years especially, but also in the endocrine receptor positive, the estrogen receptor positive breast cancer. Even these days we've had in the last year or two some new treatments come out for that. So it's ongoing. Breast cancer, I tell my patients, we probably know more about breast cancer than most of the other cancers combined. I mean, we just know a lot about breast cancer. It's the most common type of cancer for women, and it's the #2 killer of patients, that have cancer, unfortunately, because of that. But with that being said, patients are living much longer with breast cancer, and actually the mortality is declining because our treatments have gotten so good.
Well, and I think when we talk about treatments too, because of the treatment advancements, you're seeing women respond better. I mean, chemotherapy is a lot different than it was years ago. Some individuals do have to have chemotherapy and radiation, but not all. I mean, I think
Correct,
that's something
yeah.
we need to recognize. Not everybody gets the same treatment options.
That's right.
But you're seeing those advancements where individuals are actually able to have the quality of life that years ago that they were not.
That's right. So breast cancer, it's really important for the audience to understand it's all about catching it early. So that's why mammogram is so important. So just to put that kind of in numbers, so when you're looking at the 5-year overall survival, so 5 years from now, what is your chance of being alive? So when you talk about breast cancer that is in the breast and not anywhere else, it's about 99% 5-year overall survival, which is fantastic. That's assuming you do the appropriate treatment that's recommended. If it's made its way to a lymph node, you're talking about 85% 5-year overall survival, still very good. It's only after it's spread, so it's in the liver, it's in the lungs, it's in the bones, that drops down to about 26%. So really detecting it early with yearly mammogram is the best way to really cure your cancer because you're catching it early.
And that word, I know you said spread, sometimes people hear that word metastasized, correct?
Right.
So that's where it does spread. So really making sure you talk again with your risk factors. When should that individual have their mammogram, making sure they keep up with their annual mammograms depending upon their risk factors, and taking that time out. Really, it doesn't take that long to get a mammogram. What about male risk for breast cancer?
It's really the same as female, and actually most male breast cancer are treated very similarly to female breast cancer, so it's just thankfully much less common. It's also, if you have a family member that had a male breast cancer, that person definitely should be tested for a hereditary genetic risk, and that's one of the indications.
Are you ever considered maybe cancer-free or the remission rates when you hear individuals that might have completed their treatment in the survival rate?
Oh yeah. So if you have an early stage breast cancer, even a node-positive breast cancer, you go through the appropriate treatment, and again, not everybody gets chemotherapy or even radiation. If you go through those steps, I would expect that you would be cured, especially if you would be early, in your stage of breast cancer.
Well, we really have come a long way then with our treatment, and making sure that you partner with your healthcare professional to make sure you know what is the best treatment options and also prevention for you too. We've talked again a little bit about individuals understanding kind of where they are as far as their risk factors. When you said family member, does that mean actually close family member, mother, sister, or does that even go into the aunts and grandmothers?
Well, really, if you have 2 or more first-degree family members,
Okay.
so that's, you know, your mom or your dad, right? Your brothers, sisters, kids, you know. Once you start talking about aunts and uncles and cousins, then it becomes a little bit more murky, I guess. That's where you probably have to have a significant amount of history, or history on one side of the family where you could see that a gene mutation was potentially be passed down. And one of the other things that's, I think, maybe an advancement in this field is now when we, you know, most people know about BRCA1 and BRCA2, we call it BRCA1 and 2. That's the mutation that Angelina Jolie had. A lot of press was going on when she decided to have a mastectomy. So, but there are other genes too. So one of the things we do now is when we test for this, or at least when I do, I test the entire array of suspects, I guess. So it's a whole panel of genetic defects and not just the BRCA1 and 2. So we're able to do that now with one blood draw. We can test the entire possibility of genetic risk.
Again, another advancement that we have seen over the last many years with all the research really that goes into breast cancer, and it is constantly changing. I'm sure as we're talking right now, you know, advancements are being made. When should a woman and or man, depending upon their family history, actually start talking to their doctor about mammograms?
Controversial, but most people say at least age 50. I still recommend the age 40 just because personally I've seen a lot of patients in their 40s and even younger with breast cancer. There's a lot of discussion there about, you know, is it economically feasible to do these screenings at the age of 40? Are we doing more harm than good with all the unnecessary biopsies? So it's a very controversial field, but I think certainly at the age of 40. The other thing you can do, and there are various online risk calculators you can do, but try to find one that has or includes your family history. You can plug in your own data, how old you are, how many family members you've had, have you ever had a biopsy on your breast, and it will give you a score. It will give you a lifetime risk of you developing breast cancer. If your score is 20% or more, then an MRI of the breast is also recommended on top of the mammogram. So every year you would get a mammogram and an MRI because your risk of developing it over your life is so high. So that's another thing that people can either talk to their doctor about, or if they see me in clinic, they can talk to me about it. I'll usually pull it up and ask them right there. It takes, you know, a minute or two to do the calculation, and then I can tell them if they need an MRI too. That gives a higher definition of looking for breast cancer.
Well, we appreciate all this information that you've shared with us today. I think basically we'd like to encourage, you know, women and men to look at their risk factors, talk to their physician, their healthcare professional actually, about making sure that they have that mammogram. Really encourage, you know, yourself and your buddy, your friends, to make sure that they're getting in and getting that taken care of, because what you're saying is really early detection can really lead to better outcomes if something is found. Anything else you'd like to share with our viewers?
This is Breast Cancer Awareness Month, and I think getting a mammogram or urging a family member to get a mammogram is very important. Again, trying to get into that 99% 5-year survival risk or group would be the most important thing to do, and the best way to do that is detect it early.
Well, we appreciate again you being here with us, and for more information, if you'd go to our website at www.hmh.net, and we hope you tune in next month for another important edition of Health in the Heartland.